Just say you even can die from it. It's crazy. It's crazy. I've taken it for 2 years right now. I don't even
take it with the benzodiazepines or the opioids, or you drink too much, it can really suppress your central nervous system, and then you could die. That's a problem. Side effects, especially in relatively young people, include hostility and agitation. It can increase the size of the male breast, not the female breast. It can cause liver abnormalities, jaundice, elevated liver function tests. It can cause high blood pressure and palpitations. And in older individuals, their kidney doesn't work as well, so more of it builds up inside the system, and as more of it builds up, then you become sleepy. So sleepiness is a significant problem in senior citizens especially. It can cause a variety of problems because it can cause you to be sleepy. You've got to be careful driving the car or operating heavy equipment. It can cause a hypersensitivity reaction, cause your tongue to swell, cause your blood pressure to fall, breathing abnormalities. And there's an interesting syndrome called DRESS. And DRESS stands for drug reaction with eosinophilia and systemic symptoms. And what that can do is...
Yep, we start to say with him. When you're drinking it, you can't drive, you can't do anything. You know what I mean? Like, this is the Gabapentin. I drinking it over 2 years. This bottle they have 180. This bottle I have 80. And I have to drink two, let me see, I have to take one capsule like 2 times a day. I drink all of that. Finish.
Inflammation in your heart, your liver, your kidneys, your muscles, your lungs. That's a major issue. And if you stop taking it suddenly and you have a history of seizures, well, it can cause you to have epileptic seizures. And it can cause increased incidence of suicide and suicidal behavior, and especially in children between the ages of 3 and 12. It can cause significant emotional lability and hostility and thought disorder and movement disorders.
For 2 years.
And in animals, it can cause a pancreatic acinar cell carcinoma. And preclinical.
Yeah, this is all the effect is due to you. Make you dizzy. If I hold a bottle, it's fall down. Like, I stay sleepy all day, can't stand up. It's just like I taken it for a whole 2 years. It's crazy. Even the low bino, can't get up. That's
the usual side effects: headache, nausea, vomiting, constipation, indigestion, diarrhea, dry mouth. It can actually cause some teeth problems because it interferes with saliva. It can cause some blurred vision and slurred speech. If you take it with the benzodiazepines or the opioids, or you drink too much, it can really suppress your central nervous system, and then you could die. That's a problem. Side effects is...
All right, we stop right here. After 2 years of surgery, I drink this. This bottle have 180 pills in it, Gabapentin. This one was full too. That's the rest. This one have 80 pills, Gabapentin. I've taken it for 2 years. You know what it did do to me? With my vision, you can't hold nothing. That's why we call the side effect. Listen to the doctor.
Some of the inflammatory cytokines and protein kinase C, the side effects, that's what you have to worry about. A lot of side effects in taking gabapentin or Neurontin.
That's why
side effect of dizziness. Probably up to 30% of the people who take the drug, at least initially, are going to feel very dizzy. And remember, I said it's a central nervous system depressant, so 1 in 5 people are going to suffer from fatigue or sleepiness or drowsiness or gait abnormalities. Some of the people are going to retain water, so they're going to have swelling of hopefully just the feet, sometimes even the face. Some people develop tremor from taking the drug, or their eyes dart back and forth like that. Sometimes it can cause in men sexual dysfunction, erectile dysfunction, loss of libido.
I have some information I want to share with you all guys. Okay, all this is medication I taken after surgery. All right, they call them Gabapentin, 400 milligrams. Listen to that doctor.
Feeding. Used more in women than it is in men. It seems that it's used as frequently in people over age 60 as it is under age 60. There's some drug interactions that you have to be aware of. The drug interacts with other central nervous system depressants. So interestingly, if you take it, it is going to decrease the concentration of hydrocodone in your system.
I take it.
That's interesting, but it means that if you stop taking the gabapentin, then you're going to have an increase in the amount of hydrocodone in your system, and that might be sufficient to knock you off. That's a very dangerous situation. If you take it with morphine, morphine is going to increase the concentration of gabapentin in your system, and as you'll see, gabapentin has a significant number of side effects. So how does it work? It's a central nervous system depressant. It works similar to a chemical that you might have heard of, GABA, G-A-B-A. And it works on a variety of areas of the brain. It also probably interacts with a group of other receptors. It probably works on the NMDA receptor. And
yeah, that's the way I try to explain. I can show you right now. Look at this picture where I'm coming from before the pills put me in that situation. Before the gabapentin put me in that situation. You're going to see, I'm going to show you right now.
Off gabapentin, but he could only do so slowly, 400 milligrams at a time.
It had effects on my life that were, if I wasn't in reasonably good shape, it could have been a normal person probably would have taken their own life.
Fishman told